Hello, everyone. My name is Jillian, and I am the owner of Post Surgery Care of Atlanta, where aftercare matters to most. And I thank you all for coming in to view another video. Tonight, we're going to be talking about, or today, depending on what time that you all are watching this, I'm going to be talking tonight about how important it is to be well hydrated before surgery. From my previous experience in working with patients before surgery and getting their body prepared for after surgery, many times, all the time, I ask them about their hydration, with drinking water, with 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 beverages that they drink, and how they keep their body well hydrated. And many times they will say that, oh, well, I drink water, and sometimes I'll drink coconut water, sometimes I'll do some Gatorade, um, sometimes I'll do soda, alcohol, just different things that they do. And so, and all those different items are fine to drink, just so at any other day. But when you are preparing your body for surgery, you want to have your body well hydrated with the right types of liquids, um, and 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 many times, that's not really being um, talked about or shown to the patient before surgery on why is it important, or explain them why that is important, that the body is well hydrated with the right kind of liquids. And so the body is made up of water. It's not made up of coffee, tea. It's not made up of protein drinks, hydration drinks, and carbohydrates type of drinks. It's made up of water. So the blood in our bodies is made up of 83%. Bones, water is made up of 22%. And the brain, the central nervous system, is made up of 74%. So we can say that the number one fluid that's very comparable with our body chemical composition is water. And so, and how important it is for us to drink water in keeping our joints lubricated, to making sure that we are keeping our cells and our tissues and our organs flowing and operating like it's supposed to, keeping ourselves from not sticking together, keeping them where they're just flowing through, because the blood circulation is flowing at at an optimum level, at an optimal level. And so that regulates into blood pressure, that regulates into lubrication of the joints for mobility, that helps with body temperature of the core body temperature of the human body, that we know is 96.8, some is 96.5. It kind of varies back and forth. But the body core temperature is so important, because when you are preparing your body for surgery, um, depending on how well hydrated your body is, it's going to set the it's going to set the body up. So when you are on the operation table and you're having a lot of blood loss, your body is not going to go into extreme dehydration. It's not going to be that they have to give you so many bags after surgery. Now you will have a saline bag that it will have the IV in to lubricate, to replenish the body of the blood loss that has happened. But to go into your operation table operation with your body well hydrated is preparing the body to where it's able to stabilize the body core temperature, mobility, as in flexibility in the joints. It's keeping with the skin, keeping it lubricated to where it's easier for it to heal after surgery. Before surgery is able um, to be a great protector, protective barrier. It's a great insulator from the temperature when your body starts dropping down from the anesthesia. It also helped with, brain function. When your body and your brain is well hydrated, it's able for it to kind of wash away that anesthesia where you're not having so much of the fog after surgery that it won't lag as long. I have seen where the anesthesia has taken up to 48 to 72 hours for the anesthesia to actually really wear off of my patient, even down to even with their body core temperature, where it was prone to fluctuating back and forth, where when they're getting up to just do some walking around, taking a shower, their body temperature rises up very high, and so it makes it where they start, having like hot flashes, or they start feeling very faint, very lightheaded, and so the 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 significance of having a well hydrated body is so pivotal for before care, um, before surgery. Another thing is that water plays a role in regulation of our blood pressure and blood sugars, balancing out with the different chemical minerals. We got electrolytes, we got carbohydrates, we have sugar, we have um, we have those different compositions, those biochemical compositions in our bodies with the electrons and the protons and the newtons. So it's so important that we're making sure that we are keeping our bodies well hydrated. We can do Pedialyte. Pedialyte is great um, for putting in, replenishing those electrolytes and carbohydrates and vitamins that we need in our body. Um, I know many times, water, fusion water with the fruit that we drop in our water and let it sit in the fridge for about a few hours. That is great because that is a great way to naturally regulate our our glucose levels. Um, Also is when we're working out, preparing our body for surgery, that we are replenishing our body with water from the sweat or and also the toxins that are releasing from our body from working out. The next thing is also with when our bodies are highly hydrated, it makes it easier for us to have a bowel movement and able to flush out um, any type of backup fluid that may be there. That when we have a nice flow of of, of fluids that are being replenished in our body to keep us well hydrated before it, just get rid of all those toxins and any type of fluid that may be trying to build up. It's ways to kind of flush those things out and just keep everything moving in a normal fashion, or I would say in a more regular, a regulatory fashion, so the body can stay functioning at its highest capacity. Um, so um, and again, it's not just about liquids of water and Pedialyte, but also electrolytes and carbohydrates. I was doing some research, and they have these carbohydrate drinks that you can drink. Um, I would say some days before your surgery, that would be great for you to drink those. It's great for regulating the blood sugars. It's great for making sure that you are getting the sodium and potassium and other electrolytes and fluoride um, um, in your body after I'm sorry, before surgery. And many of them you can get like those Ensures. They have them. They're called the Ensure um, pre-surgery, and so you can definitely drink those to definitely make sure that you are hydrating your body at a optimal level. And so I didn't want to take too much of this time in this video, but I wanted to take some time to really stress the importance of why it's important to get your body to where it reaches a well hydrated body. And that's something that we have to keep working on every day, every moment that we can, to making sure that we are fueling our body with water, that we're fueling our bodies. We do Pedialyte if you want to do an alternate from the water, and also the carbohydrates drinks, and you can have those. But I would definitely say talk with your doctor about, even with the Pedialyte, especially the carbohydrate drinks, just to make sure that 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 particular drink will definitely be comfortable with your body and your conditions. If you have any underlying conditions preparing for surgery. And so, if you, I mean, my main thing I would say is just making sure that you are drinking water or doing the fusion water with the fresh fruit in it, like mangoes, pineapples, um, kiwis are good. You can definitely do cucumbers. There's certain foods that have a lot of electrolytes and water in it, like cucumbers have a good vitamin there. Watermelon has a great high percentage of water in them. Um, I would say even pineapple. Pineapple is great for hydrating the body. And so there's many ways to do it the natural way of making sure that your body is well hydrated. But also talk with your PCP and your surgeon to say what are some other liquids that I can drink that will give me that will position my body to be prepared for surgery. So when I come out of surgery, that my body, as it is getting replenished from drinking water and having the saline bag that they're using to replenish the body immediately after surgery, um, but how it can easily start repairing itself and replenishing and just getting it into a better place to where the body is not at a complete um, destitute or depletion of liquid with so low of a percentage of water. Just make things just easier for your brain to function um, at a higher capacity than it would if you were not hydrated properly. Making sure that your body temperature is regulating properly, making sure that your skin and your joints are getting the necessary nutrients and fluids to keep it where it's nice and has a glow to it, and also your joints are lubricated. Um, just making sure that any other body parts of the body, the biochemical composition, such as the cells, the minerals, the cells, the tissues, the organs, um, tissues, and all those things are getting the necessary fluids that it needs for them to operate to help heal the body after surgery. So I hope that you all enjoyed this short video. I really tried my best to keep it to small bites for you all to take in, to learn small bites and really take a moment to take in what I'm telling you and to incorporate into your everyday life, but especially if you are preparing for surgery, to build your body for acute injury from surgery. So after surgery, it can start healing itself to have a more positive surgical outcome and to prevent any surgical complications that may happen after surgery. So, if you all like this, please click the thumbs up. Make sure that you are subscribed. Make sure that you are telling your friends and family about the YouTube channel. And definitely we'll be back again to make more videos. You all stay blessed. Happy Labor Day. And if you are interested in scheduling a virtual consultation just to go more deep dive into how to prepare your body for surgery, you can definitely go to www.postsurgeryatlanta.org, where you can click where it says make appointment and you will see virtual consultation, and you can go ahead and book for the virtual consultation and we will take it from there. But again, thank you all for watching this video. My name is Jillian, the owner of Post Surgery Care of Atlanta, where aftercare matters the most. And I will see you next time. Be safe and stay blessed.